Hi guys, I'm back. What are we going to talk about today? We are going to talk about, let me see if I can get this so you guys can really see me. Can you guys see me? I think you can. The health system. Okay, so I'm going to give you guys a couple stories and bring you up to speed where I am today. So here's the thing. The health system is totally broken, and let me tell you my thoughts on it. These are my thoughts. Definitely, if you want to, you can sound down below in the comment section. So here's the thing. A couple months ago, so it is May, so I would say maybe 2 to 3 months ago, I was at the doctor's office, right? So I was at the doctor's office. I was talking to the person that was checking me in for a procedure I was getting done. And then I was talking to her, and it was just a whole mess. It was supposed to be easy check-in. It was supposed to take a whole 2 minutes, something that 2 minutes escalated to 20 minutes. I have a job, so I have insurance, and by today's standards, I'm supposed to have pretty good insurance. Okay, so after we're done, we get everything straightened away. I almost missed my appointment, and actually, did I miss my appointment? I did. No, they still tried to fit me in because it was such a hassle, because basically we went past the time that my appointment was supposed to start. So I sat back down, was waiting to be called. Another lady, and it wasn't too far from the desk, the check-in desk to where I was sitting. She sat down, and she was being checked in, and I didn't hear the whole what she was getting done. But the woman asked her, she said, you guys, and I want you to listen very carefully, do you have insurance? What is the name of your insurance? And the woman said, no, I do not have insurance. I'll be paying cash today. And I kind of stood there, and I was like, oh, wow, okay. So then I got called back up to the desk for another question or something, and I politely asked. She didn't give me any of her information, but I just had a few questions for her. And I said, because mind you, the first time when I went up there, we were discussing how much I was going to pay out of pocket just for this, just to be seen, right? It's called a copay. So I was like, okay. So I'm like, okay, and I brought money with me, but you know what, you guys know I'm super cheap, right? I do not like to spend my money. And I'm just going to go back 18 years. So when I had my son 18 years ago, you guys, and of course I know things change every day. 18 years was a long time ago. Things were very different. I literally had my son in a hospital, and I've been in the same field for 23, 24 years. I gave birth to my son totally free, and you guys know what I'm saying. I had no out of pocket. I did not reach into my purse, my handbag, for nothing. I was covered through my insurance through the grocery industry. And my son was just a little bit sick, so we had to stay, I think, an extra day or so. When we left the hospital, you guys know what I left with? I left with probably like 2 weeks worth of baby milk. The nurse was so good. I had a beautiful delivery. It was just really good. I left with probably like a week's worth of Pampers, just a blanket, all kinds of stuff. Try to do that today. I don't think so. I haven't had any more babies since then, but I mean, it's very different. So now let's fast forward. So it seems like every time that I go to a doctor's office, I have to come out of pocket, and we know there's deductibles, but I really started, like about 2 years ago, I really started sitting down doing the math, and I'm like, how does this all work? Because I'm gonna say some things, and it might hurt a few people's feelings, but these are my thoughts. This is what I think. But as a working person, I'm really trying to do the math and figure out how people actually make it work. I mean, the working class or the middle class. Now, I'm sure if you guys are kind of somewhat worldly, you know things that are going on globally and whatnot, and how they say the middle class is being like basically it's disappearing. You're either like maybe 5 to 10 years from now, it's only going to be the rich and the poor, no in between. So I consider myself middle class at this particular moment. And I asked her, okay, so I asked her, I said, you know what, if I didn't have insurance, how much would it cost for me to have this procedure done? And I said, better yet, don't answer that. I said, if I didn't have insurance, I said, I wanted to pay cash. In some instances, wouldn't it be cheaper? She looked at me, she said, and we weren't talking about I wasn't getting into that other lady's business because of HIPAA laws. She can't really tell me anything, and I wasn't asking. But she said, yes, sometimes. Now, isn't that some shit? You could go to the emergency room and say, or no, you want a procedure done, okay, and you say I have insurance, and they say okay, it's 10,000 for the procedure. Oh my dear God! But your insurance will pay 80%. You pay 20%, right? So that's $2,000, right? Wow. Okay. Can someone put me on a payment plan, please? I'm just saying. Then on top of that, you have to meet your deductible, which depends on where you work, what your job is. They say for the whole year you have to spend at least $10,000 out of pocket for your job to pay for your procedures. Who spends 10,000? I mean, if you have a family or whatnot, but if you're really, I can understand if you maybe like are very sickly. But here's the I might say this word wrong, conundrum. Okay, so if you have a job, right? And you obviously have to work to maintain your insurance. What happens if you constantly keep getting sick and you can't work? How do you, because you have to maintain certain hours, correct, at your job so your insurance kicks in. What happens if you keep getting sick? So how do you maintain your job, and how do you maintain the hours if you're always out to maintain your insurance? How is that fair? Now this is the part that's going to really hurt some feelings, you guys, but I'm just going to say it. I'm going to go for it. If you are on the system, meaning welfare, okay, and I'm talking about welfare, not Medicaid or maybe, actually I don't know these systems because I'm not on them, but I'm not talking about where like baby boomers, older people retire and then they get on Medicaid. I'm talking about the people that don't have jobs, that don't want to work, that have multiple children. I'm just going to say it. These are my thoughts, and I'm just throwing it out there. The system is really broken because today I could have one child, right, and decide that I want to have 3 more children and jump on welfare and keep pumping out babies. Who pays for that? I'm just curious. Oh, I have a job. I'm paying for that. Okay, so people that have 1 children, 2 children, 3 children, and don't get me wrong, children are a blessing. I wish I would have had more. I really wish I would have had more, but I just have 1. But if you can't afford to have children and take care of them, why do you keep having children? Now, it's everybody's right to have children, absolutely. But I really admire when people can actually take care of their children. And it hurts my heart when I see people that have children that are not taking care of them properly. And I'm not talking about having them in the latest designer clothes or, Jordans or, shoes and name brand out. I'm talking about they're clean, they're well fed, they can... You know what I'm trying to say. I'm just saying. So back to what I'm saying, the system's broken. So I could have no job, no source of income, but I can keep having children, get provided with food stamps, possibly Section 8, and all these programs that assist me. But I continue to still have children, but I technically really can't take care of them like I would want to, or maybe I should. But I have other people paying for my health insurance. So I'm gonna tell you another story, and this is what I kind of didn't want to do it, but I wanted to say anything. But look, I have a friend, right? She has a job, so she's kind of a little bit sickly, right? So she approached me about a month ago, right? And she needed some money. Now, I do not lend out money, you guys. Just to let everybody know, if you ask me for money, I could have it. I'm not going to give it to you, because when it comes to money, that's how friendships, relationships get ruined. People forget to pay you back. People don't want to pay you back. They think they're entitled to it, whatever the case may be. But she needed it. You know what she needed it for? She needed it for prescriptions. She needed it, and I knew she needed it for prescriptions. So I gave her that money for prescriptions, and I wanted her to have it because she needed it. Do you get what I'm saying? So this is my thing. How is it that this person that has a job, right? This is what I'm talking about, the system's broken. She has a job, but yet she keeps getting sick, right? So she's not able to maintain the hours at the job to keep the insurance to help her pay for the prescriptions. How the hell? Someone tell me something, because how does that work? But yet, if I was on the system, quote unquote, or on welfare, if I needed something done, I would go to the doctor, and I would be able to get all the kind of medication, have children, have procedures done. And for you guys, I'm not saying I'm perfect. I don't know how the whole welfare system really works, but I know that many people could have. And I'm just talking, because I'm talking about babies or whatnot. If you want to give birth and have multiple children, no problem, you could have multiple children, and someone's paying for that. But yet, if I want to have a procedure done, I have to come comfortably, depending on your job, $5,000 to $10,000 out of pocket just to meet my deductible, and then my job will kick in and start paying 100%. What happens if I'm really healthy? Because for the most part, I'm truly am really healthy. I've been healthier in the past, but the last 2 years have been kind of rough for me. My health has been going up and down, right? So I've been in the doctor more. Every time I go to the doctor, you know how much I have to pay for a copay? A copay, $30, 25 to $35. Now imagine if someone's sick or they're very ill and they have to go to the doctor once a week. What happens if they didn't have a job? That's a lot out of pocket. I'm just saying, a lot out of pocket. What happens if you do have a job? That's still a lot out of pocket for some. Not for all, but for some. And then once I hit my deductible, there's no way I'm going to hit my deductible, because I'm just not that ill or sick to where I'm going to hit. I think my deductible for the year is either $7,000 or $9,000 or $10,000. I couldn't remember what they said, but there's no way that I'm going to hit that. Then on top of that, if I have a procedure done, I'm paying my company will pay 80%, and then I pay 20%. That's still a lot, because if you think about it, if a procedure's $10,000, procedure, surgery, whatever, is $10,000. I'm still coming out of the pocket 2 G's. 2 G's. Wait a minute. Do I get to eat for the month? I don't know. Back to the story. So we went to go get her prescriptions. I paid for them and whatnot, and I had no problem doing that. Things like that, I have no issue doing, because it's something she needed. It was life or death. She needed it. So I was there for her. But it really hurt my heart, because I saw this woman that I do care. I consider her a friend, not doing well, and she's ill, and she's not able to work to maintain the insurance, the hours at work to get her insurance, to pay for her medication. How the hell does that work? The system, I really think, is really broken, and it's really, not starting to piss me off, but I'm really reevaluating a lot of things in my life. So for example, so you guys know, 2019, I'm all about solutions. I'm going to rant and rave. I'm going to talk about how this health system is broken, but then I'm going to give you solutions. So solution is what? Oh, switch up the whole game. Get as healthy as I can so I don't ever have to see a doctor again. I'm just saying, I changed my eating habits again. So when I was real young, you guys, I used to be vegan. I used to not eat any meat and eggs, all that. First I didn't eat meat, then I didn't eat pork, and then I bounced around to maybe being vegan for a little bit, and then I was just all over the place when I was younger, but I was way more healthier, of course, when I was younger. And then I would say maybe the last, 5 to 10 years, I kind of like sugar. I love sugar. Sugar, not white sugar, because I haven't had white sugar in my house for over 20 years, but I mean like cakes and cookies and tasty treats and stuff like that. I love butter and bread, and I know that's my downfall. So lately I've really been switching stuff up, and I've been going back to the old me, which is fresh juices, more vegetables, very little meat. And actually, I'm not a big meat eater. I just recently started eating chicken. I love fish though. I love salmon, but I don't really eat, when it comes to steak, I don't like steak. I do very little ground beef, but I start eating chicken and a little bit of pork. Sorry guys, yeah, it's true. But yeah, all that stuff it has to go. It has to go, because once I'm trying to find balance right now. So once I balance out to where I want to be and get healthy, I don't have to worry about going to the doctor and all these deductibles and whatnot. Of course, you're going to have maintenance. You want to maybe do your checkups. Of course, I'm sure if you have heart issues, you want to go to the doctor. That's not something you want to ignore. But really, there's solutions out there on getting healthy. More exercise, a lot more water, cut out the sugars and the breads and the butter. I'm just saying, those are my solutions to where I don't even have to deal with the doctor anymore gouging me. Because I'll tell you guys something. I just went to the doctor, I think yesterday. And do you guys realize that I've had almost, I think, either 5 to 7 procedures done in less than a year? and I've been shelling out cash for every last one of them. And they're not all identical, but some of them are. I've had some procedures done twice, some 3 times. And I'm thinking to myself, what happened to that paperwork, or what happened to that information from that procedure? Why aren't you using that for your information? Why do I have to go do the same thing again and pay $200, $100 out of pocket plus a copay? I'm a little confused. And then, of course, how does it work? When you do your follow-up visit, it's usually free because the doctor's telling you results and whatnot. But if it's not a follow-up visit, it's a regular visit, you're paying $25 to $30. Now, let's do the math. I just threw out $200, $2,000, $1,000, a couple $100. That's a lot of money. That's a lot of money for someone that works. Now, depending on your job title, how much you're making, but goodness gracious, I do believe the system's broken, because I know if I didn't have a job, and I'm not saying multiple kids, and you guys don't drag me, but if you want to, feel free, because I'm here for it. This is my channel. If you want to leave a nasty comment down below, feel free. You can. Doesn't mean I'm going to acknowledge you, but you can. But if you want to have a real conversation or dialogue, please leave like an intelligent comment down below, and I might say something back to you. But I really think the system's broken. And I'll throw this other one out. So I remember hearing a while back, maybe earlier this year or last year, about a lot of people that use insulin, which I think you need. What I mean by need is, to regulate and whatnot. So there was a gentleman, I think they're suing the company or whatnot, or there's a movement going on, people that use insulin. It takes, and don't quote me on this, but you may correct me down in the comments down below, that it takes like a couple dollars, $3 or less than $10 to make insulin, but they're charging thousands of dollars for insulin. And there's so many people that are on insulin that can't afford the insulin, even with their insurance, okay? Even with their insurance, they can't afford it, so they skip it, or they try to make the insulin last. Now, how does that work? It's so expensive. It costs you X. And I do believe if you're running a business, of course, you have to make profit and whatnot. But why, if something costs you $3 to make, $3, especially in the health industry, that you have to charge thousands or hundreds and hundreds of dollars for this product? And people can't even afford that unless they have their own welfare, or they have really great insurance. It's just really sickening. And the more research I do, and I've always been a researcher, just looking into things, see how much things cost, or the real bottom line. But it's just really, now that I'm using more of my insurance, because like I said, up until 2 years ago, I wasn't using my insurance. The only times I've used my insurance was when I gave birth 18 years ago, maybe for like a little minor surgery on my foot. And then the last 2 years is kind of like snowballed a little bit, and I'm shelling out more money. And I'm like, how come it is that I put into the system? And what I mean by that, I'm productive. So meaning I'm contributing. When I look at my check, I see all these things getting taken out: my Social Security, my pension, my dues, and whatnot. Okay, so I'm productive in society, I would like to say, but yet I can actually, because I have multiple streams of income, you guys, and that's why I do, because at any moment anything can happen, and I need to maintain the way I live, the way my family lives. So it's like, okay, so I'm a little confused. What happens if you're like really on the borderline of like middle class and poor? How could you, like, for example, if you worked at McDonald's or something, making $7-8 an hour, how do you really, and you have a family, how do you really survive? It's like you're caught in the middle. Okay, you got a minimum wage job, but you need some assistance, so you jump on welfare to kind of help out, but then you kind of get stuck there. Do you get what I'm saying? I guess that could be another subject, how the system's set up to keep you just right there. The system's right there to where you don't want to go you can't go any higher, and if you fall down below, they're okay with that too, because then you'll be asking for more assistance. Anyways, I'll leave you guys with this because I think I'm done rambling. But what is my solution? Is the health system broken? Yes, it is. In my eyes, it is very broken. Because do I believe everybody should have health insurance? Absolutely. I think, and that causes another debate, because in different countries they have universal health insurance, and some people love it, some people don't. A lot of people have different opinions, but do I believe everybody should have health insurance? Absolutely, across the board, because there are people out there that have chronic diseases, like babies that are born with cancer, just things like that. And it's like, oh my God, how would you possibly be able to pay out the gate for cancer treatment and just all these different things? It's crazy. But at the same time, people that do work and put into the system, it seems like people are doing a lot more taking and not putting in. Do you get what I'm saying? So a lot of people are doing a lot of taking out of the system, Do you know there's less people working right now? So if there's less people working, that means that there's less people contributing to all these different funds, like Medicaid and, Social Security and whatnot. So that should be a great indicator of what's to come. And that's a no-brainer. I just said that just thinking out, talking with you guys. Think about that. If there's less people working right now, right? And that means there's less people putting into the system. So if people are just taking, what does that say about those systems? Are them getting depleted? And when I decide to retire, or whatever the case, will they still be around for me? Just saying, just something to think about. But then I'm going to hit you guys with this. I'm going to leave you with this. And I think this is old school. So, and I'm like 41, but I think this is like my parents' time. Tell me if you've ever heard of this. If you don't work, you don't eat. I think everybody should eat, of course, but that really it speaks volumes to me. If you don't work, you don't hustle, you don't be productive, you shouldn't eat. I'm just saying, if you're going to be lazy, and this is for the lazy people. Hello, hi, lazy people, if you're out there. I'm not talking about the people that are productive, have jobs, have side hustles. I don't care if you have a minimum wage job, a medium job, you're making 50,000, 100,000, you have your own business, you're an entrepreneur, whatever, that you're being productive. But for all the lazy people out there, I don't know, there's something to bounce around. If you don't work, you don't eat. So do I think the health system is broken? Absolutely, because I'm seeing a lot of people that are working very hard, or they're working and they're struggling to make ends meet. With that being said, I'm going to leave you guys. I'm going to leave you. Hopefully I said some gems in there. I don't know. If you want to have a meaningful conversation, please leave a comment down below. We can go at it. I like to debate. I don't like to argue, though. I'm not going to argue with you. If you want to debate, or if you have something to say meaningful, so be it. Maybe I'll give you a heart or a like or whatever. But if you're a troll, I don't even see you. All right, you guys, if you like this video, please give me a thumbs up. Feel free to give me a thumbs down. Leave a comment down below. Please like and share, you guys, especially if you think the system is broken. And I mean, 2020 is fast approaching, you guys. What do you have set in place to make yourself not super healthy, but healthy, to where you don't have to rely on certain systems that could possibly bankrupt you? Let me say that again. What do you have in place for yourself, your family, that will ensure that the next generation and you will survive? You'll be okay. All your money will not go to the health industry. I'm just saying, meaning doctors and whatnot. Just saying. Just my thoughts. All right, you guys. Bye.